So a little bit about vaccinations. Every year your pet should receive an annual health check, and as part of that annual health check, vaccinations will be given as well. Vaccinations should start for your dog from when they're very young, as puppies, to make sure that they're protected against the common contagious diseases that we see in the UK. So you should bring your puppy in as soon as you get them to discuss vaccinations and care programmes for them. But as I said, it's not just about having the vaccination, it's about having an annual health check for your pet to make sure that there aren't any signs of problems. And that's important because if we can pick up signs of problems early on, it's much easier to treat and deal with those problems rather than waiting until they're much further progressed. Pets don't often show signs of disease very readily at home, and we can often pick up on things really early through questioning owners about how their pet is doing at home, and obviously by giving them a thorough physical examination as well. So during the consult, the first thing that we'll tend to do is to have a chat with owners, discuss how their pet is at home. Are they eating and drinking normally? Are there any symptoms that are worrying at home at all? Coughing, vomiting, diarrhoea? Is there any weight loss? Anything that's concerning? Behavioural changes as well. And after we've got a good idea of how the pet is at home, we'll then obviously give them a good physical examination from nose to tail. We tend to work methodically from their head backwards, and that will include having a good look at the eyes, making sure there's no signs of problems and discharge, checking the nose, having a good look in their mouth to see if there's any sign of dental disease or gum problems there, and that obviously gets more common as your pet gets older. We'll have a look in the ears to see if there's any sign of inflammation, redness, soreness, wax at all. Sometimes you'll pick up a bit of a smell if there's any problems inside the ears as well. And moving back, we'll tend to just be feeling all over the pet as we go along, seeing if there's any lumps or bumps, any scabs within the skin, any coat problems, are there any bald patches or sores anywhere. And we'll check down the limbs to see if there's any swelling, any signs of pain in any of the joints, especially as your pet gets older and joint diseases are starting to become more of a problem. We'll have a quick look at the nails to see if they're long or short, if they need any trimming at all, and making sure that there's no problems with the skin in between the pads, especially at this time of year in the spring and summer when they can get quite skin diseases and sweatiness in between their pads there. So having a look over the belly as well. And then moving backwards, we'll just gently ask your pet to stand up, and we'll have a good feel inside the abdomen as well, where we can feel the major organs like the liver and kidneys inside there, feeling for any lumps or bumps or pain at all, and that will give us a clue if there's any problems with the organs inside the abdomen at all. And checking over the back legs again, over the muscles, the joints in the back there. We'll have a feel of the hips to see how well they're moving, making sure there's no stiffness or pain in those joints as we go along. A little peek under the tail to make sure the bottom looks nice and clean, no problems there. We'll use a stethoscope as well to have a listen to the lungs and listen to the heart to make sure there's no sign of any murmur or rhythm disturbances coming on. Once we've had a good check over your pet and made sure that they're healthy, we might need to discuss whether any screening tests like blood and urine tests can be done to get a more detailed investigation of how things are working inside their body. Once we're happy that your pet is healthy and well, we can then administer the vaccination. That may include giving them injections underneath the skin at the scruff of the neck. Some vaccinations we administer into the nostrils to protect them against kennel cough. So we'll discuss what's required for your pet at each annual vaccination health check to make sure we're protecting against all the diseases necessary for them. The final part of the annual health check is just to have a discussion about other preventative healthcare measures that may be needed, such as flea treatments and worming, which are always a good idea to make sure that your pet stays parasite free, both for his health and safety and for our own as well. To summarise, do remember the importance of the annual health check and vaccination for your dog. They will receive a full examination from nose to tail to make sure that they're healthy, and then be given a vaccination to protect them against important diseases. You will also be given advice about which flea and worming treatments will be needed for your pet throughout the year.